Good morning, everybody. It's Friday, May the 8th, and welcome to our weekly forum. We're very glad you were able to join us, and we're going to start today by going to the whiteboard. This is a look at infections and testing. There are a couple of things that I wanted to point out here. If you looked at the dotted if you look at this lower dashed line, those are the estimated infection rates that we were predicting way back as early as March 1st. And you can see by looking at the solid gold line at the bottom of the chart, our number of confirmed infections has underperformed what the expectations were. One of the other things that's worth noting on this is look at the number of daily tests. That's the dark blue line. As the number of daily tests rapidly increase, and the dotted blue line that goes out through August of this year, you can see that we are going to quadruple the testing. That was part of the overall strategy, is to make sure that we were testing people, figuring out where the outbreaks were occurring. We would have hotspots or zones, and that's where the resources that the state and county had would be applied. One of the things that Governor DeSantis did that was perhaps different than what you've seen in New York perhaps, is he made the decision that the large majority of the available resources to fight COVID were going to be applied in nursing centers and retirement communities across the state. And that really has had an impact in keeping the infection rate and morbidities down. This is deaths per day. And you can see it starts over there in March. It wasn't 0 deaths, it was our baseline. And so every year we always have deaths related to flu, influenza, and other viruses. You can see where it peaked. That actually is the 17th of March. And it stepped back for just a couple of days as we sort of figured out what was going on, and then the curve accelerated from there. If you look at that pink smear off to the right, that is the anticipated, back looking forward from March 1st, that is the anticipated spread of the disease in terms of deaths per day. And you remember that the entire objective of this was to flatten the curve, not overwhelm our hospitals, so that they would be able to keep up with the infection rate amongst the population. And you can see very clearly that we have been successful in doing that. If you look at May 1st, that's the line where the solid red turns from solid to dotted. That's on May 1st is when the governor opened up the first phase 1 removal of restrictions. And here we are a few days later. You can clearly see that the deaths per day continue to decline. And when you get out there, August, maybe September, chart only goes through August right now, but September, October, we will be back to baseline. So if you look at this chart as a freestanding chart, there's some encouraging news. And it is clear that the deaths per day are going to continue to decline as long as we continue to practice good social distancing and proper hygiene. Let's take a look at the next slide. This is what has all the health experts in the state of Florida worried, also across the country. This, instead of looking at deaths per day, this is looking at total deaths from COVID going forward. And you can see it began to rise in April 1st. May 1st, it's still going up. Over the last 8 days of the restrictions being listed, that increase in deaths has continued to go up even more rapidly. Between now and June 1st, that total number of deaths is almost going to double. And by the time you get out to August, if you look at the projections, it is still, the death rate continues to climb. And so that's, people ask me, well, why, if the governor released his restrictions on May 1st, why haven't we here at Regency Oaks released our restrictions and allow people to go back to life as normal? This is a chart that graphically probably best explains this. I think it is true to say that we are going to continue to see deaths in the state increase, and the majority of those deaths are going to occur among people who are 65 years of age or older with underlying disease. And so where we actually stand in our planning is, I think we are about 2 weeks behind wherever the state of Florida is. And so if Florida started to release restrictions on May 1st, you can anticipate that we are going to be 2 to 3 weeks behind, and we won't really start doing our release of restrictions until probably, looking here, it's going to be the 15th, maybe the 21st of May before we start to seriously remove some of the restrictions. All right, let's take a look at the community and state numbers. In the state of Florida, there are now 38,828 confirmed cases, and we have broken the 1,600 number for fatalities. In Pinellas County, we went up again last night in both confirmed cases and in fatalities. We're at 820 confirmed cases with a 56 deaths. And in Pasco County, they are at 289 cases and 9 fatalities. In the United States, we are at 1,256 cases with over 75,000 fatalities. So the numbers are rising, but they are slowing down, I guess, overall. In terms of testing, we are making real progress there. Here in Pinellas County, there have been almost 18,000 tests with only 820 confirmed. Our total hospitalizations here in Pinellas County are 241. And in our specific zip code, it is 16. So that number is stable. This is the 6th consecutive day with a stable number within the Regency Oaks zip code. So those are the numbers, and I'm going to go to Leslie now with the quarantine and update on Regency Oaks resident status.
Hello, we currently have 11 residents that are under quarantine for non-COVID related hospital stays. We do this because we want to be precautious to make sure that just in case if they are carrying the virus, that they are quarantined for 14 days in their apartment with temperature and symptom checks, just so we are not exposing our other residents from hospital stays. We have no staff members currently under any quarantine. We have no positive tests for residents or staff members. Our current resident that was previously positive, they are now testing negative, which is great news. And we have no confirmed cases here on campus for residents or staff.
Good morning, I'm Rance Macy. I'm the healthcare administrator at the health center next door. This week, the Agency for Healthcare Administration and the governor's office put out a new order, and the new order is requiring all hospitals to have any patients going to a skilled nursing facility to have 2 negative COVID tests in a 24-hour period. That's something we were already requesting, but now it's going to be a law, so we're excited about that. What that means for us is we're going to continue to have our isolation unit in the health center for all new admissions for the foreseeable future. New admissions will stay on a 14-day quarantine in the health center. Those restrictions will not be lifted until the CDC and the Department of Health give us other guidelines. Also, I just want to mention that even though Regency Oaks might start getting back to normal later this month, hopefully, the health center will still not have any visitors. That's per the governor's orders and the regulatory bodies like the Agency for Healthcare Administration. We're going to probably be last to have any visitors next door. So I just wanted to mention that. We still remain COVID-free, and we're very happy about that. Thank you.
On behalf of Christine Sinchikovich, Personalized Living is working on their transition from Brookdale to Life Care Services for their new date of May 31st.
Good morning, everyone. Happy Friday. This is Ophelia. This is George Haley's puppy that comes in for puppy daycare, and I call her the therapy dog. We just love taking care of her when she comes to visit. Financially, just wanted to remind everybody that when they do have their grocery shopping done, a receipt will be given to you in your bag, and then you will see the total charge on your next statement. So if you have any questions, please give me a call.
Your EVS director. Just want to inform you of one of our team members who has decided to retire after 23 years. Her name is Elidia Noble, and you probably have seen her in the North Building during the weekends. She only works during the weekends in the North Building. She will be here, as the last day will be tomorrow. So if you see her around, please give her a great and warm goodbye.
Hello everyone, Ricky Baca, Food and Beverage, Johnny, Chef Johnny. We just wanted to wish everyone happy Mother's Day, and on Sunday, look for a few extra treats. Have a great day. Thank you.
Good morning, everyone. I did want to remind all of our residents, I know we're probably going a little bit stir crazy, of the things you can do inside of your apartment, or if you would like to take a nice brisk walk. You can also enjoy our pavilion area if you would like to enjoy lunch outside. We are just asking, if you do partake in a card game or any activity, that it is at least a group of 4, and you try to keep at least, and if you are partaking in any group activities that the group is at most 4 people, you can enjoy cards, a nice book together, anything along those lines. We are asking you to keep the group at no more than 4 people. As Brent stated earlier, we will do the transition very slowly because we are trying to keep everyone safe at the community, and we do appreciate your participation in that. Thank you.
All right, thank you very much. That concludes the administrative reports out, and we do have some questions that have been submitted by residents. So Lauren, I think you have our first question.
Yes, I've had residents,
Hold on.
and I've had some questions from residents inquiring when they receive their shopping bags, whether they do the grocery shopping or if we provide that service for them. They have some concerns regarding bringing germs into the apartment, and what do they do with the bags to keep themselves safe once they receive them.
Okay, thank you. So this virus is primarily an airborne virus. It's not that it cannot be passed from surface to surface, but it primarily is an airborne virus that is spread through coughing and sneezing. However, there are some best practices on how you might handle grocery bags. Those bags are going to have been touched by multiple people, perhaps the store where they're bagging them, the driver who's returning them, maybe a maintenance staff member who is delivering them to your apartment. The best practice that we recommend is that you unbag your groceries, put them away, dispose of the disposable grocery bags, and then wash your hands thoroughly. The risk is not that you're going to get a contaminant on your hands. It's that you're going to get a contaminant on your hand and then touch an eye, a nose, or a mouth. As long as you wash your hands properly after handling something that potentially has been contaminated, you should be fine.
And another question that has come up from some residents that have either called me or stopped by the office,
They have some concerns about large gatherings that are occurring in the community, specifically the sports bar and residents gathering in the breezeway nightly. How are they to position themselves to keep everybody safe?
So our official position is we strongly discourage any large gatherings of more than 4. In reality, I understand how difficult it is to be isolated in your apartment, and how much value there is in being able to go outside and be out in the nice weather and to just see other people. And so what I would ask of residents is to be smart about your decision making. And I have decided not to close down the breezeway. I have not removed the chairs because residents have been cooperating so far, and I expect that they will continue to use good judgment and make good decisions. If you are out on the breezeway and enjoying that evening time with a meal and friends, be careful about what you're doing. Don't put more than 4 people at a table. Make sure that you're 6 feet apart. Don't allow the crowd to get so large that it's unsafe. When you reach what is a safe capacity, move to other areas. Go and take advantage of the alfresco dining or the deck or the tables outside the north and south interior entrances. You've just got to be smart and wise about making personal decisions. When it comes right down to it, all of us are going to be safe because each of us have responsibility in making good decisions and keeping all of us safe together.
Yesterday I stopped by the South Break Room as manager on duty, and I noticed a lot of bags full of food from yesterday's dining drop-offs. Is there anything that residents can do with the extra food instead of putting them in staff break rooms?
Question. Thank you for that. So that is not a safe practice. You are handling that food multiple times, and there is just in normal times, it's not safe to leave food unattended on a break room table for hours at a time because the person who might pick it up and take it, they don't know if it's been there for 2 hours or 6 hours. So just that part of the practice is not safe. We are providing you more food than what you need. And here's the thinking behind that. Many people are able to supplement their grocery list either through friends, family, the service that we provide, or independently going out to the grocery store themselves. But many of our residents are not able to take advantage of those services, and so we are providing more food than what is required just to make sure that nobody's going hungry. If you get excess food and you're not going to use it, throw it away. Yes, it is a waste of food, but it's a practice that is safest for everybody concerned, both our staff and for you as well. Excess food, just discard it, and we'll get back to normal soon enough.
I have a question, Rance. The folks are wondering what the status is in the skilled nursing facility in regards to personal protective equipment.
Well, I'm happy to report that we're in the best situation we've been in as far as our PPE equipment since this crisis began. I'll be honest, 2 months ago it was kind of scary. It was hard to come by things. Now we have over 2,700 masks over in the health center. We have over 300 gowns, a lot of reusable gowns. We have face shields now, which we didn't have a month ago. We have over 150 face shields, plenty of gloves. We actually got our first batch of N95 masks this week. So we're actually in a really, really good shape, and we just have I think we have everything we need now to get through this.
Tiffany, I have a question. With the holiday that's coming up and all the restrictions that are going on, and I want to go see my family, how can I go about doing that?
Great question, thank you. We are encouraging all of our residents to still take the best caution as possible, especially with our demographic at the community. So we do have access to iPads that you can get from myself or Ginger to use virtual medias, whether that's through Zoom, which is an app, FaceTime, you can do Facebook Live, or just a phone call to your family members. We do understand that this is a strain, especially with the holiday weekend of Mother's Day. We know how important it is to love on your family members, but right now in this climate, it is not the best choice to make right now. So we are strongly discouraging it. So if you could possibly use the virtual medias that we are encouraging you to use right now, and then hopefully as the time goes on, we'll be back to loving on our family members.
Mother's Day!